vessels that provide blood and nutrients to the heart muscle. When these become diseased, there's a buildup of plaque, there's buildup of calcium and other different components that cause narrowing of the vessels. And as you can imagine, when you have narrowing of these vessels, you decrease the blood supply, and God forbid, if you have a complete stoppage of blood to the heart muscle, then the heart muscle can become weak or ultimately die. So that is what coronary artery disease is. There are classic symptoms of coronary artery disease that patients should be aware of. The classic crushing substernal, left-sided chest pain radiating into the left arm, into the neck, associated with sweating, associated with shortness of breath. These are our classic symptoms, and if patients have these symptoms, they should seek medical attention. Furthermore, when patients have coronary artery disease, they may notice that these symptoms are worse with exertion. If you're working outside or you're exercising, you may have worsening of the symptoms, and they may improve with rest. Again, these are typical symptoms of coronary artery disease. There are atypical symptoms, and sometimes it could feel like it feels like heartburn, or you may feel like you have an impending sense of doom. So there's a wide variety, but again, there are the classic symptoms that everyone should certainly be aware of. I'm a big proponent of preventative measures, especially when it comes to coronary artery disease. When we discuss risk factors of coronary artery disease, we discuss non-modifiable risk factors, things that you can't really change, such as your family history, versus modifiable risk factors, such as do you smoke, do you have high blood pressure, do you exercise, how is your diet. These are all things that we can work on together to prevent either the beginning or the progression of coronary artery disease going forward. If you're diagnosed with coronary artery disease, there are many available options to you. Coronary artery disease is a very common ailment in the United States. In fact, heart disease is the #1 cause of mortality in the United States. Treatment options include the non-invasive options, modifying risk factors, providing patients with medications that decrease their blood pressure, decrease their cholesterol burden, providing patients with healthy eating options, preventing or stopping smoking. Whereas the second part of our treatment options are the invasive. So if, God forbid, you have a heart attack and there's a complete occlusion, that's something that we can go in there and fix. Or if you have a very advanced blockage within one of the arteries of the heart, we can go in there and put, either do a balloon angioplasty or place a stent, which would keep the vessel from recoiling or forming new plaque, and then placing you on medications. And as a cardiologist, we can work together to figure out what is the best treatment option for you.